My name is Amy Bryan, and I'm a nurse practitioner. Well, I've been at Trinity for over 30 years, and most of the time I have been in cardiology. I started out as a bedside nurse working med-surg, but I quickly progressed to telemetry and to critical care. So most of my time at the bedside was focused on cardiology. From the bedside, I left and went to Dr. Smolovich's office, cardiology office, as his office nurse, and then eventually became his nurse practitioner. So he taught me so much, and so that really was what stirred my love for cardiology. I think cardiology is very interesting. The intricacies of the mechanisms of the heart are very complex and complicated, but there is always new technologies coming out, new procedures, new medications that can improve the patient's quality of life and decrease mortality. So it's always changing, and it's never dull. It's always interesting. Trinity, apart from others, is because our cardiovascular service line, the energy to expand our services so that the patients don't have to go very far from their community. They can stay right here, and then we can treat them here. They don't have to travel. And that's what they deserve. They deserve the best, and that's what we give them. A typical day for me is usually starting in the hospital. I make rounds on our patients, and then I go to the office and I see patients. It's my role right now as working as Dr. Majewski's nurse practitioner. Not only does he perform heart surgery, but he also performs vascular surgery and thoracic surgery. So a little more diverse now than I used to be when I was just in cardiology. So I see a variety of patients, which again, keeps me having to constantly educate myself and keep myself aboard on all the new things that are going on in our profession. I've had many experiences that has confirmed that this is where I should be. But one that just happened a couple weeks ago was a wife of a patient of ours approached me and thanked me for ordering testing, which actually found that her husband had a serious illness that he was unaware of. And Dr. Majewski was able to perform surgery before the patient had any complications or any life-threatening illness. So that, brings me great joy when I can, help our patients that way. What I especially like about working in surgery is the teaching that I can do for the patients. So of course I do pre-op and post-op teaching, but I also can teach the patients things that they can do as far as their lifestyle and things like that in order to prevent the complications of the illnesses that they have. Another thing that sets Trinity apart is that we do everything we can, from housekeeping, the dietary, to the nurses, to the practitioners, to make the patients feel comfortable and have a good experience while they're in the hospital. Patients are sometimes reluctant to go to see their doctor or go to the hospital when they have a symptom or a sign, and you just shouldn't wait, right? Because there's always something that we can test for or some procedure that can be done, and you want to catch things quickly before things get out of control. So don't wait. Come and see us.